Hello, my name is Wukem Sanda, and I'll be presenting my project, which is called the LINK Initiative, LINK standing for Local Innovation for Knowledge and Access. I am a Zambian medical doctor specialized in pediatrics and child health. I'm also a pediatric and adolescent HIV expert with experience in sexual violence against children. I also consult on HIV prevention. Currently, I'm not employed full-time, but I do part-time lecture and clinical work. So why did I choose this project? In Zambia, about only 44% of adolescents can identify HIV prevention methods. And due to this, there's obviously low uptake of HIV services. This low uptake has been attributed to low or inadequate knowledge about these services' existence, negative attitude of healthcare workers that offer these services, persistent community myths and misconceptions, and limited parental engagement. What my project aims to do is to build resilient and integrated health systems through engaging community members and adolescents in co-creating solutions to increase the uptake and comprehensive knowledge of HIV and sexual reproductive health services in the community using a community-based approach. The goal is to improve the uptake of HIV and sexual reproductive health services using a community-based approach amongst adolescents in Lusaka province. The design will be a mixed method research and participatory co-creation. What are my aims? My aims would be initially to have adolescents, peer educators, and champions to conduct a needs assessment using surveys and interviews to assess the multi-level determinants that to uptake these services. Then healthcare workers would engage adolescents, community leaders, and parents to co-create a community-led intervention that would address these identified barriers. Implementers, such as myself, would then conduct a feasibility trial of the developed interventions in two districts, an urban and a peri-urban one, for comparison, to determine and assess if there would have been improved knowledge, awareness, and uptake of the HIV and sexual reproductive health services. My vision for this project is shared voices, shared health. I've often believed in community involvement versus engagement for effectivity and even just sustainability of certain approaches. So therefore, my vision would be a strengthened community capacity to support adolescent health services. So run by the community, conducted by the community, and assessed and expanded by the community. So what are some of the identified barriers that were found through the study is that there is lack of adolescent-friendly private spaces that limits access for the adolescents. There's insufficient peer educators who are trained to offer comprehensive and age-appropriate HIV and sexual reproductive health information. The parent-related barriers hinder adolescents' engagement, and there's a lot of myths and misconceptions that loom in the community still. There's a lot of substance abuse, and this has been due to lack of recreation activities, which also enhances risky behavior. And there's weak collaboration between the schools, the churches, and health facilities. So the proposed solutions here would be immediately to train adolescent peers to run these spaces, partitioning the counseling rooms, conduct community sensitization, and to form community task forces that would run these programs. They would promote, sensitize, and implement these interventions. So this would be my immediate. And then the midterm ones would be to promote sports and other recreation activities, to develop IEC materials, and to promote positive parenting. Long-term would be to eventually have domestic financing for the sustainability of these services, and this would be done through community development funds. I have identified opportunities to collaborate with other cohort members, such as the mental health model, the cycle of empowerment that looks at menstrual health, and integrating and engaging initiative for persons with disabilities. I've really appreciated this project because it's allowed me to be authentic, to be inclusive, to be strategic, to be impactful, and enhance women in leadership. Thank you.